If you look at the question, it asks which of the resolutions listed below is the most difficult for the examiner to control. The correct answer is choice D. This can be considered as elevation or slice thickness. Compared to the other items, these aspects here have many limitations, even if the examiner adjusts the equipment panel. Let's take a look at the related video. As you can see in the video, axial and lateral here can be considered representative types of spatial resolution. These aspects can be improved by increasing the frequency or by focusing, which are ways to enhance the resolution of the image. On the other hand, in the case of elevation, since the thickness is determined by the transducer itself, there are some limitations to what the examiner can adjust. This isn't particularly difficult, so you can simply memorize it. Let's move on and look at the next question. The key point in this question is the term multiple echo. The answer most closely related to this concept is choice A, multiple reflection. If you look at the image, you'll see that there are two strong reflectors present. These two reflectors cause repeated reflection patterns, and as a result, multiple echoes are formed. This is the characteristic of the multiple reflection artifact. So, terms like multiple echo or two strong reflectors are related to this concept. You can organize this information along with the image. Let's move on to the next topic. Now, the question is asking about the types of artifacts. The most important point here is the term double image structure. Next, there's the phrase change in beam direction. If you just remember these two keywords, you'll be fine. Usually, the patterns that appear in cardiac ultrasound are fairly set. Usually, the aortic valve is the one that appears most often. The double image phenomenon that occurs at the aortic valve, as well as the change in direction, are related to the refractive artifact listed as option B. I'll give you some additional explanation while looking at the diagram. If you look at the image, under normal conditions there is a single aortic valve, but as the beam travels along, it encounters a rounded area which causes a refraction phenomenon. Due to this refraction, a double image is formed, making it appear as if there is another valve right next to the original one. This phenomenon is most closely related to refractive artifacts. To summarize the key point once again, if there is a change in the direction of the beam, or if a false valve appears, making it look like there is an extra valve, you should consider this as being related to refraction. Let's move on to the next topic. Looking at the question, there is an important point to note. There is a term called prosthetic valve. We're trying to evaluate regurgitation occurring at the mitral valve, but it is described that certain areas are not clearly visible due to artifacts. So the question is asking which factors have limited the imaging in this case. The use of this prosthetic valve suggests that regurgitation was not visible due to shadowing occurring behind it. So the most relevant answer choice is B, which is shadowing. Let's take a look at the related image. As you can see, there is a prosthetic valve at the location of the mitral valve. In the image, because it is a strong reflector, it appears as a highly echogenic structure. You can also see that there is dark shadowing behind it. When shadowing like this occurs, there can be various limitations in identifying regurgitation occurring behind it. So, you can think of this as the kind of question that asks about these aspects. In short, just remember that shadowing is a representative artifact that can occur with prosthetic valves. Let's move on and look at the next question. Now the question is asking about contrast imaging using cell lines. It is asking which item is not related to the evaluation techniques that use this. Basically, using a cell line is often for the purpose of evaluating the right heart via the IVC. So, this cell line is used when assessing the right heart or when evaluating shunts that go from the right to the left side. Therefore, options B, C, and D can be considered related to these items. I can explain that option A is the one that is not related. In the case of aortic regurgitation, you need to apply a method for evaluating the left heart, not the right. Let's organize and review this content by distinguishing between them. If you look at the video, you can see that this area shows the right heart being filled. This is an evaluation using the cell line. In the video on the side, you can see that the left heart is being filled. For this part, you should note that it is an evaluation using microbubbles. So, depending on the structure or disease you want to evaluate, just remember to distinguish whether you need to use microbubbles or apply the cell line for the assessment. That concludes the explanation of the basic content. Next time, we will continue with the commentary on the following sections. See you next time. Thank you.